Hello, friends. How are you all? Uh, at this time, when the world is trying to get back on its feet after long suffering from COVID, the detection of monkeypox, a rare and dangerous viral disease, has raised red flags in several countries of world. Now, what is this monkeypox? And these days, everywhere we are listening, we are in reading and listening, watching about this monkeypox. So, in this video of mine, let's get some information about this new disease, monkeypox. On July 23rd, this month, with over 16,000 cases reported from 75 countries of the world, the WHO, the World Health Organization, declared it to be a public health emergency of international concern, PHEIC. Why? Because this is to acknowledge the medical challenges that may come up and also to alert the governments of different countries to prepare and be ready with a health system to cope with the coming medical challenges. Now, this monkeypox has been a low level of endemicity in Western and Central Africa for decades. So there were cases being reported from Africa since 1958, and this disease was there in Africa. But now in past few weeks, the global concern is there because of more and more cases being reported from different parts of the world. So now the concern is global and not only for Africa. Now, seeing the challenge of this more cases recently being reported in last few weeks from different parts of the country, from different parts of the world, the WHO Director General said in a media briefing, with the tools we have right now, we can stop monkeypox transmission and bring this outbreak under control. It's essential that all countries work closely with affected communities to adopt measures that protect their health, human rights, and dignity. India has reported its fourth case recently. The fourth case which has been reported from Delhi, and this case is not having any history of foreign travel as well. So that is the cause of concern for us Indians, and we should understand now, because this thing is there, we should understand the disease, what are the causes, what are the symptoms, what is the treatment available for this monkeypox, and what are the preventive measures which we can take to prevent this disease. So let's discuss about this disease, and whatever I'm going to discuss in this video is the information which I have gathered from different sources. So it's not and personal this thing, it's all the information which is already available. I've gathered this information and I'm recording this video for you all to make you all aware about this disease. So first of all, let's see why the name monkeypox. The name monkeypox is Actually, this disease, this monkeypox was discovered first in 1958 in Africa, and where the research was going on colonies of monkeys, and there was an outbreak, pox-like outbreak in these colonies of monkeys. So this has lent the name monkeypox. This is not only present in monkeys. This disease is present in many mammals. The mice, the rabbits, the squirrels, they also have been infected from this disease in past. Now, the first human case, which was discovered in 1970, and that was from Congo. And this monkeypox is similar to the smallpox, because the family of virus, that is orthopox virus genus and variola virus, this is the same family which is causing smallpox infection, and it has also been detected in, as I said, in other mammals also, like squirrels, mice, rabbits, etc. Now, this disease was there for many years in African countries only, and is spread to other parts of the global areas, to other parts of the globe, has become a cause of concern now. Now, the variants, there are two strains, two variants are there. One is Congo variant, Congo strain, and second is West African strain. Out of these two, the Congo strain is more dangerous, because the mortality rate with persons infected with that strain is 10%, whereas the West African strain, the mortality rate is 1%. And luckily, whatever cases have been reported recently are all of West African strain. Okay, now the next thing is, what is the mode of transmission? How is this virus getting transmitted from infected person, infected animal to human? There are two. The transmission is of two types. One is from infected animals to human being, and second is from infected human to healthy human being. So in case there is infection from infected animals, it can be either when the person is getting bitten by an infectious animal. An animal which is having this disease, having monkeypox, is biting some human being, healthy human being, that human being might get this infection. Second mode is when there is the human being coming in contact with the animal's blood or body fluids or fur. The fur, body fluids, or blood of the infected animal is coming in contact with the healthy human being. And the third is when the human beings, the healthy human beings, are eating the meat of an infected animal that has not been cooked properly. So these are the three things, these are the three ways by which the virus can be transmitted from an infected animal to a healthy human being. Now, how this virus can be transmitted from an infected human being to healthy human being is through clothing, bedding, or towels used by an infected person. Suppose a healthy person is using the towels, combs, beds, utensils of the infected person, there are chances of transmission of this infection from infected person to healthy person. Touching skin blisters or scabs, as this is the main symptom of this monkeypox. There are blisters or rashes on the skin, and they get converted into scabs, and these scabs, if any healthy person is touching, the chances are that the infection might get transferred to healthy person. Or coming in contact with droplets of the person, infected person, cough or sneeze droplets of the infected person. Then this disease is transmitted by sexual activities as well. The proximity, when the persons are in proximity, the droplets of cough may come in contact with each other, or the sexual activity, the transmission, it can be sexually transmitted, because many recent cases have been seen in gays. So that is another mode of transmission of this kind of. Then another mode of transmission is from the pregnant woman to her baby through placenta. So these are the different ways by which this virus can be transmitted from healthy person to an infected person, because this can be transmitted from infected animal as well. The difference between smallpox and this monkeypox is this only. Smallpox is transmitted only from human to human, but this is transmitted from animals to human as well. Now let's come to the next thing which we should know about this disease is what are its symptoms. Like, how will we come to know that the person is having monkeypox? What are the symptoms? First of all, we should know that the incubation period. Now, what is incubation period? Incubation period is the period, the time period, which is taken by the virus from infection to showing the clinical signs or showing the symptoms. So that period is called incubation period, and that period for this virus is 5 to 21 days. Now the common symptoms are like common flu-like symptoms, fever. All other viral diseases have the same symptoms. The viral intense headache, then muscle ache, then exhaustion, fatigue, swollen lymph nodes, sore throat, cough, and etc. etc. But the distinctive symptoms which are there in monkeypox only are the skin rashes. Within 3 to 5 days of infection, the person will starts getting skin rashes, and these rashes normally begin on the face first and then comes to the different parts of the body, like sole, palm, chest, arms, different parts of the body it can be seen. But the recent cases have shown that the rashes are more visible and more painful near or on the genitals or anus, but it could be on the other parts of the body as well. Now this disease lasts for 2 to 4 weeks, and these rashes will slowly the liquid gets filled in these rashes. They become blisters, and from them they form the scabs, and these scabs they slowly they get dried up and they fall off. So these scabs also are source of transmission of this disease, because if any healthy person is touching those scabs or the rashes on the skin of an infected person, that person might get this infection as well. Now the rash can look like pimple or blisters, and it can be itchy and painful as well. Now, who are more vulnerable for this disease are, as for other diseases, as for other viral diseases, the immunocompromised persons. So their immunity is weak, and the immunity is weak and they are having comorbidities as well. So these persons are more vulnerable. Then pregnant women and children are also, because recently the cases have been reported in children as well. Now let's come to the treatment point. What is the treatment available? There is no proven treatment available for this monkeypox. Smallpox vaccine has been proven 85% effective in preventing monkeypox. So, in countries, there are many countries they have started giving this smallpox vaccine, and here in India also, because persons who are below 45 years of age, they would not have received the smallpox vaccine, because by the time it was eradicated from India. So that smallpox vaccine is 85% effective. So this WHO guidelines says that this vaccine can be given, and it can now be produced and stocked. And another thing is that an antiviral drug, that is tecovirimat. This is an antiviral drug which is developed for smallpox. This can also be now domestically produced and stocked as per WHO guidelines. So this antiviral drug can also be used for treatment of monkeypox. Now let's come to the last part. Now that we know what are the symptoms, what is the cause, what is the mode of transmission, let's see how we can prevent ourselves from getting this monkeypox. So to prevent, we should the same as we were following. Now it's the new norm after COVID, the hand hygiene, washing your hands frequently, the putting up your masks and respiratory etiquettes and personal hygiene. So all these things which are going to help us from keeping away from this disease, monkeypox, and social distancing. Until and unless it is necessary, we should avoid crowds so that the chances of infection are rare. Now the health system is gearing up to response that combines the prevention, surveillance, treatment, and risk communication. The government has drawn up an excellent response plan, and health system of our country is gearing up to respond to all this, to implement all the planning which has been done by the government. So there is no need to be panic. There is no need to be panic. This infection is a mild infection. The mortality rate is very, very less, and the symptoms are not very severe, and the disease, the self treatment, like the disease will last 2 to 4 weeks, and we should be able to understand it. We should not be panicked. Just be aware and alert. Don't be alarmed, don't be panicked, and most importantly, don't get confused with the symptoms of any other infection. If you find that somebody is having these symptoms, immediately consult a doctor. Isolate yourself and avoid sharing towels, combs, utensils, or beds of that person with other family members. So this is all we can do for it. This was just an information on this monkeypox, so that all of us should be alert and aware and informative. So we should, the knowledge is power. We should have the right kind of knowledge to prevent any kind of medical challenge. So friends, be safe, be healthy, and the most important thing is be happy. All the very best. See you soon with the next video. Thank you.